birth, that is, being born is probably the most traumatic adventure that you will ever go on in your life.
And it's not okay that moms are continually told and dads are continually told that chiropractic care isn't safe or that it's not effective. Firmly grounded in this, roots planted, that chiropractic care for newborn babies is 100% essential.
If that's why we see in that birth, we can get over these hurdles. The neurology that's not programming like it should, we can go in and we can affect that and we can change that in much quicker. Like there is developmental milestones that need to happen at certain ages.
Yes.
Right? These things still need to happen, but that is what's happening within the public, that we're just changing when these developmental milestones should be happening. That is setting our children up for huge disadvantages. Our babies are being born under stress. How do you as an adult react when you're stressed?
Hey everybody, welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss, and as always, I have the beautiful, wonderfully radiant Dr. Julie Wyss with me today. Dr. Julie, how are you?
I'm good.
Are ya? Really? We're good?
Yeah.
Okay. We had to perform some minor surgery before we got rolling today. This microphone stand, it was limp. It needed some good screw tightening and to get this thing back to where it belongs because it kept falling over.
I feel like that's an entirely different topic.
Well, you know, it was a good topic last summer. And today we're talking about babies and newborns. And this is a really, really important time of year to talk about kids getting care, especially newborns, especially littles. I think it's one of the most amazing and wonderful compliments we get when we get a chance to take care of newborns. It's an incredible honor. It's something that I hold near and dear to my heart, that I hold a lot of respect and place for. And to just be able to check and see how them little babies are doing, those newborns, incredibly safe, incredibly precise, and incredibly effective. I would go out on a limb, not even on a limb, firmly grounded in this, roots planted, that chiropractic care for newborn babies is 100% essential for great nervous system communication and function.
Well, I don't know how else you'd want to enter the world. I mean, other countries, there's pediatric chiropractors on staff. And so that is the norm for them. And here we are in the United States, and it's a far-fetched idea. And unless you know somebody or you've talked to somebody and you understand the importance of it, sometimes you're not even, like, you don't even know that it's an option. But I mean, birth, that is, being born is probably the most traumatic adventure that you will ever go on in your life.
It's important, just a vital journey.
It's well, and it has to happen, right? And no matter how it happens, but things happen along that journey, and to have 100% function between the brain and the body for that child the moment after they're born, like, why would you not want to start life any other way?
Well, I think that a lot of parents just don't know the options available.
Correct.
I think they've been told by their pediatrician that we paralyze, maim, hurt children. They're given a bunch of wives' tales and fairy tales. And you know what's, to be quite honest with you, is most of the things that sound like a conspiracy theory are actually true. So when it comes to chiropractic care for children, you will have other healthcare professionals out there, and you know who you are, telling people that chiropractic isn't safe for children. That is 100% wrong, and it's a 100% lie, and it's probably one of the most inaccurate, uneducated decisions and comments you could ever make in your life. The reason why it's so effective is because that brain, that nervous system is fully forming in a mom at 20 days old. It's running that child's body. It's running their life from that point forward. Mom isn't running it. They're living off of themselves for the first 12 weeks, and their nervous system is fully forming, and then it's running every cell function thereafter. And to think that it's not important to get that critical communication back between the brain and the body is 100% wrong. And it's not okay that moms are continually told and dads are continually told that chiropractic care isn't safe or that it's not effective or that it's not needed for newborns and children to have.
Well, it just shows the non-educated or fear, because I think fear plays a big factor in this. And just with anything, like I've gone to a restaurant and had a bad experience. That doesn't mean that I'm never going to go out to eat again. I've gone to the dentist and had a bad experience. That doesn't mean that I'm never going to go back and see a dentist again. I understand people have had bad experiences at many different things, but that you can't extrapolate that to everything else that you come across in your life.
We have to understand the level of what's needed for a child to grow and what's going to allow them to function the best they can.
And I think the part, like, right, so if it went wrong for you, you went on a date, it didn't go well, you're going to reevaluate, well, what did I do? What can I do differently the next time? If I went out to a restaurant, if it was the dentist, right, and it wasn't a good experience, well, what didn't I like? So the next time, what are you going to do? You're going to look for things that are different. And I think rather than just shutting something off and saying, okay, that's not for me, I'm never going to do that, that's a poor decision, or again, like the fear comes into it, and we just need to have additional resources and understanding of, okay, what exactly are you looking for? And that's why we try to be very upfront with everything that we do. Yeah,
and the most important part of that you talked about was the negativity. Was when you have a negative experience, the worst thing you can do, though, is to go into the next experience expecting a negative. If you're always looking for the negative, what's going to show up? The negative. Well, what about the positives? What was the patient experience like? What was the clinic like? Like, yes, you may have had a bad experience as an adult. That doesn't mean that the child's going to have a bad experience. And in fact, I will tell you that most children, like 95% of them, have very favorable, positive experiences with a chiropractor that understands children and is certified in children. The experience is awesome. The parents' experience is awesome. They get an incredible education as to what's functioning incredibly well in that child and maybe what's not functioning or communicating like it should be. Therefore, the child's development isn't where it needs to be, or it's not there yet. It doesn't mean it's not going to get there, but with good care, they will get there. And commonly with parents, what they're told is that basically when medicine's hands are tied, when you have a child that has breastfeeding issues, when they have colic issues, when they have indigestion, spitting up, their body's not functioning correctly, or even constipation, they're told that once things are exhausted on the other side of healthcare, that there's no other option, that the child would just grow out of it. Well, children never grow out of anything. They just grow into the next malfunction. They just grow into the next issue that then causes symptoms. So typically, what we see in children is that when they have breastfeeding and latch issues when they're young, they have oral problems when they're older. When they're in 5, 6, 7 years old and they're going through critical language development periods, their language development is poor. Science has seen this. Childhood development has seen this. Chiropractic has been talking about this literally for the last 100 years, that when those things don't get put online properly to begin with, we see it change later on. And then when they have developmental issues with even language, as they get a little bit bigger, then they start complaining to their parents about headaches, poor sleep, anger management problems. They fly off the handle, or they get really, really upset, or they just fall apart and cry nonstop. This is all signs that your child is not able to then adapt and properly cope with stress, so then it compensates. Yeah, and it's not okay.
Adults do it all the time.
Oh,
right?
yeah.
We brush it off. It's no big deal. And then we wait and we wait and we wait. And then all of a sudden, there's this huge problem.
Yep.
And the struggle is that the thing didn't happen overnight.
No.
This neurology has been changing for probably weeks, months. It could be years for some adults, right? So it's not going to get fixed in 1, 2, 3 visits. We have to rechange. We have to reprogram the neurology, and that's what takes time. But that's what's so amazing with babies, right? 9 months, 10 months in utero, but then maybe if that's why we see them at birth, we can get over the neurology that's not programming like it should. We can go in and we can affect that, and we can change that in much quicker time. Yeah.
And one of the biggest things that a parent can notice right off the bat is if they have normal function is can their child turn their head from left to right effectively, easily, without looking to the right, and then looking to the left halfway and then bringing their whole shoulder across, or turning their whole body to turn. Like if you're an adult and you're sitting in your car and you go to look out your side view window, like let's say you're in the driver's side and you go to look left and you have to turn your entire body to just do that, that is a sign that your neck's not moving appropriately. Well, is it not a concern then? Why isn't it not a concern then when it's a baby? Mm-hmm. Because babies are pliable, they're flexible, they move very, very easily. They have really good tone, but they bend very easily because they had to come out of a birth canal. So why would something that's the most flexible that early on in their life development not be able to move? Why would their range of motion be off? So we need that looked at right away. And it's critical to their development from that point forward.
And that's if a baby's laying on the floor, right? And you're like, yeah, they're always looking that side. Or breastfeeding moms will notice that they only latch on one side versus the other side. Or it always feels like my baby doesn't want to look at me, right? Maybe they're looking the opposite direction. Those are all those signs that, hey, something is going on. And like there is developmental milestones that need to happen at certain ages for your child. We can't just, because everybody is so subluxated and the neurology is off in these babies, we can't just go and change what the book says, right? These things still need to happen, but that is what's happening within the public, that we're just changing when these developmental milestones should be happening. Those are red flags. That is setting our children up for huge disadvantages down the road. And
you see it's the American Academy of Pediatrics that literally changed the milestones of when a child should be crawling from 6 to 8 months and pushed it out to possibly 8 to 10 months, and it's okay if they don't.
So we know that our kids are struggling, but they aren't giving anything to help fix the problem.
Yeah, and what fixes the problem is getting back to normal communication with that nervous system. Back to that, what that little brain's designed to do, function, and control, and then their bodies just heal and they thrive instead of compensate and break down. Super, super tense babies is another thing that moms and dads deal with a lot, where post-birth, they come out very, very tense. Rigid. They come out rigid. They come out almost nonstop ticked off.
Those ones you can't bend to put in the car seat that are just like boards when you're trying to hold them. They don't want to cuddle in because they can't. They physically can't.
Yeah, and I'll have dads come in and say, well, he's just tight. Yeah, he shouldn't be tight. Moms will say this to dads, like, hey, he extends back all the time. Whenever I try to pull him to breast, he always pushes back, or she always tries to extend back. Well, your extensors are stronger than your flexors for the most part. So what's happening is they want, and at that age, they definitely are, they want to extend back because their flexors aren't able to fire appropriately and keep them soft and curled. Because when you extend back, that's actually a defenseless position. When you come forward and bring your arms down, you're in full defense. So we have to understand that the body's designed to not go into a defenseless position when they're little. Like neurologically, that shouldn't happen. They should always be trying to curl up and defend themselves because they're born with that in mind, with defense, and to curl up and sit on mom, not extend and want to get away from mom. They're not 13. You know what I mean? Like they want to be a part of you. They want to curl in, they want to breastfeed, they want to nuzzle, they want to cuddle. But if they're constantly pulling back, that's not okay. So what that tells me is that the wiring, the communication is running in the wrong direction. This
isn't just like the attitude of your child or them not like they're just behaving a certain way. I think it's just important that they physically can't help it. So there needs to be intervention to be able to fix this problem. They're not going to grow out of it. It's going to turn into more serious issues down the road. Yeah,
and I think now that we've talked about range of motion in the head and extension, let's talk a little bit about digestion. So when we see littles that come in, especially pediatrics, especially infants and newborns, the GI tract is one of the things that is, I look at it as actually very misunderstood and not appropriately studied. And not appropriately understood as to how it functions and what its job is. The job of the GI tract, your gastrointestinal tract, do you know where your gastrointestinal tract actually really starts? That's a gastrointestinal tract. Your gastrointestinal tract, do you know where it actually starts? You just did it. It starts in your mouth. And people, that right there, if people hear this and we create the reel about this, and they're going to look at that and be like, what do you mean the digestion tract starts in the mouth? Of course it starts in the mouth. That's where digestion starts.
Well, that's also why it's really important. I mean, and we've done podcasts on this, but of why when the proper food should be introduced at certain points in a child's life. Because if digestion starts up here and it's not ready to digest certain things, when we're putting things in there, it's only going to cause problems throughout the entire system.
It will. And if the digestion is delayed in the mouth, what do you think is going to happen when it goes to exit the body?
It's probably going to be slow, or it's not going to work.
Slow, or it's going to be super fast. Your GI tract, so your actual intestines, are designed to pull across water and hydrate the body, pull across some vitamins, pull across some more nutrition and phytonutrients and things like this. But its big job is to pull across hydration and to pull across that last little bit of water, or not pull it across. And that will tell you right there, if a child's stool is extremely runny and watery and they're pooping every time they have a bowel movement, or they urinate, not every time they have a bowel movement, sorry, every time they urinate and they have a bowel movement, that necessarily should not be happening. If they have a little shart in their diaper every time you change them, they actually are suffering from some diarrhea. So their body's going to run into a dehydrated state, which isn't okay. You know, or if they're not pooping 2 to 3 times a day, they're not functioning well either. They're dealing with constipation. And I had a mom, she was a beautiful mom yesterday, literally sitting on the couch in our report of findings room. And she was asking me, she was like, Dr. Skip, how often do you think a newborn should poop? And I was like, well, why do you ask? She said, well, I've been told a lot of things, but I want your opinion before I tell you what I've been told. I said, newborns should be pooping every day. Well, why are everybody told that it's okay if they don't? Why are they always told that if you have an exclusively, they always like to use this word, exclusively breastfed baby, that it's okay that they don't poop for up to 7 to 10 days? How is that okay? How has that been looked at and been like, okay, yeah, maybe. Okay, so there is this stat. 5% of all exclusively breastfed babies will have one extent between 7 to 12 days of not pooping. But it only happens one time during the breastfeeding journey. It doesn't happen continuously.
That's, again, a common thing that has become normal.
Yep, normality to it, right? So we just start chalking it up to normality. Well, if my kid poops and your kid doesn't poop, or if my kid doesn't crawl and your kid doesn't crawl, and Michael's kid doesn't crawl and Ann's kid doesn't crawl, we're all okay. No, we're not. Like that's actually, it's not okay. That's actually alarming that we're seeing it as a trend. Because if we're trending in the wrong direction, especially in childhood development, how will those kids properly develop into functional adults?
I mean, if during pregnancy you were stressed, depending upon when you conceived, right? If it was a stressful time of the year, if you had stress at any point, and then that baby was growing in you, that baby is then stressed. So the baby's coming out already stressed. How do you as an adult react when you're stressed? Do you shut down? Do you go into fight or flight? Are you just crazy all over? What happens to your digestion? What happens to your body? How do you feel? Our babies are being born under stress. They're coming out stressed. Their nervous systems are being stressed and taxed. And that's without like even doing anything within the world.
And that shouldn't happen.
Parents aren't giving any options on how to help with that stress.
They're addicted to a very important neurotransmitter, yet can be super supportive and super detrimental to the body, and that's cortisol. So if they're coming out supported and actually hyper addicted to cortisol already because they were in a nonstop hyper stress state during pregnancy, that child is hyper stressed to begin with. Their body just isn't going to function normally. Their thyroid won't work appropriately. Their pineal glands, they're like all of these different areas that control the way they calm down, settle down, produce proper hormones for development, pituitary glands, anterior and posterior, like all of this stuff is going to work inappropriately because we have high excess amounts of cortisol in the body.
And it just doesn't fix itself.
Well, then they're hyperexcitatory. It just doesn't fix itself. It just stays that way. And then let me ask you a question. If I'm flying down the road and my car is at maximum acceleration over time, like it's just, I've got it maxed out, what eventually is going to happen to my engine?
It's going to wear out.
It's going to wear out or I'm going to run out of gas. Either way, I'm going to crash. Okay? And that's what happens in children. And that's what happens in adults. Is we go into this, they will say, you're in a hyper-excited state. So your car is flying down the road. You're redlining it.
It's not sustainable.
It's not sustainable. It's sustainable to go around a corner or pass another car.
Yeah, but it's detrimental to your car. But that's what we're doing to our health.
Yeah. And what we have to do is get it in cruise mode. We got to get that thing in overdrive. And for lack of a better term, overdrive is when your car shifts into a 5th or 6th gear, sometimes newer cars, 9th or 10th. Okay. And your car gets into a mode of cruising down the highway instead of accelerating and stopping. And it's the same thing with your body. And it then constantly and properly adapts to what's going on instead of constantly trying to compensate to its environment or a super stressed out state. Correct?
Absolutely.
I know I got all neurological on it. I don't think that was the 100% intent. But bottom line is that these children need to be checked. These children need their nervous systems looked at, and they need their bodies checked. And as a provider of chiropractic, someone that's certified in pediatric care, I feel it's a detriment if I don't tell you the truth, if I don't tell you that your children should be checked by a chiropractor, and if I tell you that it's okay, they're just going to grow out of it, is completely wrong. So where are some resources?
Again, you can go through our list of podcasts. We are always available. You can call our office. You can email our office. We are doing workshops all of the time. But honestly, just reach out, join one of our private Facebook groups because, again, this isn't a I wish I would have known type of a thing. This is a community, and so there's no judgment. If you don't know, we need to start the education. We need to start understanding at some point. And I understand it can be super scary to not know, but that's okay. Ask the questions. There are no stupid questions because, again, this is all about being able to raise our families, to raise our kids in the most unsubluxated, healthy manner that their bodies are meant to grow and thrive in.
Exactly. We're here and we absolutely love the children of our community and we just want to see them healthy and we want to be able to help you get the resources that you need. So if there's anything that you need, reach out to us, comment below, send this out to as many people as you can. We are on a mission to get to over 1,000 subscribers by the end of 2025. I think we can get there. I think it's a very, very attainable goal. And with your help out there in our community, share this to people, ask them to subscribe so they can have the best information about their children as possible. Take care, everybody. Have a great day. Bye, everyone.